This presentation was recorded at the 2015 ANZICS ACCCN Annual Scientific Meeting.
It's my pleasure now to invite Liz Crowe to the podium. Liz is an advanced clinical social worker in the paediatric ICU at Mater Children's Hospital in Brisbane. Liz has presented earlier, so I'll keep the bio brief, and thank you very much, Liz.
Renee, your voice is the voice that is missing in all of these conferences, and extremely humbling, I guess, for us to hear it all. So I think that what is really missing is more voices like Renee, so that we can really understand what that patient experience would be like. But if I had my way, I think that once a year we should all have a simulation where we come into a hospital environment and we have to put on paper underpants and a gown that doesn't tie up at the back, and for a woman, have your boobs dangling somewhere lower, depending on your age. And we should all have to be wheeled around and have people talk about us rather than to us. And I think one of the most powerful things for me that you actually said is that all day, every day, I hear fights about bed management. And what must that experience be like for families to say, you're going to the ward today if they have a bed. We're waiting to transfer you if there is a bed. We need this bed. Because you must feel like so guilty about taking up that bed, and that's a really major message that I'm going to take back to our hospital, so thank you so much. I have still not got my slides up. I have been doing a number of talks, and I don't know about anyone here, but I'm a bit scienced out today. Is anyone else scienced out? Yes, oh my, I'm over it. So I'm not going to not use the science, but I think what I want to do is really try and keep things really simple and try and give messages. And I don't think I can do it as well as Renee, but I'm going to have a crack with or without slides. So when we do have to look at the science, we know that families who come through the ICU are at a massive increased chance of increased anxiety, increased PTSD, increased depression, increased loss and grief, increased social distress. So what can we actually do about any of that in order to protect families and patients and prepare them for what's to come next? And I'm a storyteller, and so I thought it might help to tell you a few stories. So anyone who heard me speak yesterday, I can see my slides, you just can't see them, so this is going to be fascinating for you. Oh, now I don't even have my slides. Oh, there we go. So I think all of us can get into this lulled sense of, we've got this. We know this. It's routine. It's what we do every day. So when we walk into the ICU, the main thing might be like, oh, God, how long am I here for? Or I forgot to take dinner out tonight. You're trying to put your lunch in the fridge. You know, hope that you're working with someone fun. Which doctor is on, whatever the case may be. But when families come through the door, that's not their experience. They're 100% powerless and dependent on us for everything. Thank you. Woohoo! They're 100% powerless. So we need to constantly remind ourselves that the way we view the ICU is not the way the patient or the family view it. And I think we can get into this lulled sense of, you know, we understand everything. When we understand nothing from that family's and patient's perspective every day. Every day we start from scratch of understanding nothing because their day changes so rapidly. We do psychosocial assessments as social workers, and I say to our social workers, your assessment changes by the hour. Because if in the morning the person is going to die, but if in the afternoon they're much more stable, the family will be completely different. And so I wanted to share a story with you about how careful we have to be about not making assessments about families and thinking we know it all. So I'm going to talk about a social worker, and due to confidentiality, we're going to call her Liz. She may have assumed that she pretty much had assessments and being able to assess families very rapidly and very quickly and efficiently, a little bit more confident than perhaps she could. And she had to go and see a family actually in a home to do an assessment. And when she arrived, 2 big pit bulls came out and were barking on a full chain, trying to eat her limbs. And she thought, here we go. So as she fought her way up the stairs, she could hear the mother screaming on the phone to someone. First it was the police, then it was the principal, then it was the police, and then it was the principal. And she had to come in, and when she came in, the mother said, "Get your effing ass in the door." And she's thinking, here we go. And when she walked in, there was a child on the couch who was 7 years old and weighed about 7 kilos, and he was exceptionally disabled. He had physical and intellectual disability. And it was a housing commission or a government-issued house that had no fly screens, and there were flies buzzing all around him. And she was told to take a seat and had to move stuff off to take the seat. And there was nowhere to even put my things because there was cigarette ash and dirty cups, and the whole time she's thinking, I'm going to have to ring the Department of Child Safety when I get back because this is unacceptable. This mum is fighting with the police, fighting with the principal because one of her children had stolen a motorbike and was riding it through the school grounds where he was supposed to be in Year 8. And she thought, here's a go. And not me, and Liz is looking at this poor child on this couch that had flies, and he was unable to even close his own mouth. So I kept leaning back and just trying to shoo the flies away and formulate a plan about, how I'm going to report this woman who's clearly not parenting these children well. Anyway, she said to me, I said, if there was one thing that, health could do for you, what would it be? Thinking, as if you would even know. And she said, oh, hang on a minute, there's flies buzzing all around my little boy. And for those of you who are a bit older, there used to be a famous Australian cricketer called Alan Border. And she came out and she had a little Alan Border cap, and it had about 80 safety pins on it and fly screen attached to it. And she tucked it in to keep the flies, and she said, I spend my whole life trying to write letters saying, if you just gave me fly screens, it would change the quality of our lives. And she showed me the letter, and the woman was barely able to read or write, but it was very clear phonetically what she was trying to say. And I thought, you middle class, up yourself, snooty little social worker. And so anytime anyone makes judgments about a family, I think we are seeing people as a little snapshot, just a snapshot. And I said this yesterday, if you saw me in the worst moments of your life, in my life, if you just saw me in the worst moments in my day, trying to get kids out to school, or my husband saying, I'm a little tired, it's been a busy day, I'm heading to bed early, the face, you would assess me as someone who hates their husband, wants to murder their own children, completely selfish, and that's not who I am. So you take people in that level of crisis when the person most loved, most treasured, where the last word might have been harsh, might have been selfish, it might have been loving, but because people are human, and then we make assessments and we deliver those at ward rounds. Mum's a smart ass, watch out for her. The grandmother asks a million questions. It's these little comments that we make. And then people frame up their whole day based on something we know nothing about. Get in paper underpants and a gown, wherever your boobs may fall, and be wheeled around and have that event and realise just how vulnerable these families are. So today I'm going to keep it simple and talk about what are some of the things that we can realistically do that aren't huge, that are grounded in science, that we can just take away as little simple messages. And I think the first one is early engagement. The only way I can describe our social work office sits just outside the doors of our intensive care. How many people here's intensive care is locked so that people have to buzz to come in? Can you imagine buzzing to ask to visit your own husband, wife or child? Now, it's not that I'm opposed to that. For a whole range of reasons, it works. But what must it be like, particularly if you just had to pee? You just had to pee, so you just had to duck out, and you're really worried about your family member because they've been crying or in pain. And you just had to pee, and then you have to wait 8 minutes. No wonder they're angry at us. Because we're trying to do a job, but so are they. we're getting paid. We actually made a choice to do this profession. People like Renee had no choice. Like that, life changed. So it's early engagement. Don't walk past people and not see them. When my brother was diagnosed with cancer, I'd been to a conference a few weeks before where people had started this new hashtag say hello, my name is, and I was killing myself laughing going, that's pathetic. Imagine having a talk at a medical conference with a hashtag say hello, my name is. And I was mocking the speaker in my own mind. And then I started to observe how many of our staff don't say hello, my name is. Or what's worse, how many times people walk past and don't make eye contact because they don't. That's not my patient, so I'm not making eye contact. And then when you're an actual family member, all you want is for someone to look you in the eye and smile. Because it's not until it's you and it's your family member that you think, we're special. See, I know you look after families all the time, but he's special. Like, I can't live if he's dead, so you have to give me the best that you've got today. And just you walking to the lunchroom, turning and smiling at someone, makes them feel like that. So I try very hard not to walk past someone to say, do you need a hand? Just, do you need a hand? And often they say, no, thank you, I'm just waiting. It doesn't cost me anything, it doesn't even cost me time, but what does it mean for them? So I think early engagement and remembering these people have never seen the layout before. Have we told them where the toilets are? Have we told them where you can get a drink of water? You know, sometimes people invite families in and don't say that you can sit down. We don't say you can touch your family member. When you look at Renee, this very attractive, confident woman standing up here from that photo, she's unrecognisable. Imagine if that's your family member. They're terrified. They're waiting for cues from us. We have to communicate at every point. Every time we do anything. Every time an alarm goes off, particularly in that first day, people think their family members are dying. So just to say, there's lots of noise in here. This is what this means. You know, all of that is foreign language. You have to be the translator. This has to be a partnership. We can't make good decisions, medical or otherwise, if we don't understand who this person in the bed is. That they came with a whole story, a context, vulnerabilities, skills, talents, all of those sorts of things. And it has to be a team approach where patient and family are centred to the team. They're so extremely vulnerable. Everything you say, they listen, absorb and try and interpret. Everything you say. So little things, just when you're doing a handover, you're ducking out because it's morning tea break and you say, oh, just watch it, you know, like blood pressure's all over the place. I found that all they'll hear is blood pressure all over the place. They go straight out and they say, how is she? Blood pressure's all over the place. What does that mean? I don't know. I think it's bad. She had a bad look on her face. They're interpreting everything. So if you hate the team leader and you've got a face that's like, the family are like, they hate us. They don't know the dynamics, the little nuances of what goes on in the team. They're reading everything off our body language all the time. My brother had never been to hospital since the day he was born when he was about to be diagnosed with lymphoma. And as soon as he told me what was going on, I knew he had lymphoma. He didn't have a clue. And I said, you know, are you worried? And he goes, no, because everyone who's talked to me so far has had a smiling face, and I figured if it was something serious, they wouldn't. There was something really wrong. If you say, we're just going to give you a biopsy, people like my brother go, oh, well, whatever. Can't be that bad, because surely you wouldn't be going, we're going to give you a biopsy. Pretty sure it's cancer. That's when you're supposed to have a sad, grim face. All right. ICU is a foreign land. Just bring in another health professional and ask them to interpret what you've just said, and they won't be able to. And so I love it when the brother-in-law or the sister-in-law is the GP, and family said, he's a GP, they're going to interpret the family meeting, and they sit there and they're like, I'm a GP. I don't know what you're all talking about. You know, it's like, you're a doctor. You know, like, oh, my next-door neighbour's a dermatologist, so they're going to come in and help us say what's going on, and they just sit there and they're like, you know, they're more terrified. So everything we say is foreign. You have to be a translator, no different than if you were in a country and people were speaking Mandarin. What do people have to be worried about? Sometimes just saying, your loved one is in intensive care, they're very sick, but if this gets worse, if we're worried, I'm going to tell you. I always say to family members, the more people in the room, the more you have to be worried. If there's just one person, you're probably okay. I run with the Met calls, and when I get in there, the first thing I say is, the amount of people who are in the room is just our response team. Don't panic by that. Just explaining, these are our procedures. Because for the average family, it's like, oh my God, there's 18 people in the room. My child's about to die. That's all they understand. So just translating. The other thing I don't understand is, why is ICU different to life? Like, why don't staff wash up in the kitchen? No, you laugh, but seriously, if I went into your kitchen, I would be calling the Department of Child Safety if it looked like our ICU. Renee, you would be very worried about germs if you saw an ICU kitchen, or even a bathroom. It's like, seriously, someone's peed on the floor. We're all women. How does that even happen? We have to take everything we do with the same thing. Hello, my name is. You wouldn't go to a party and have someone come into a room and go, that was a computer, it wasn't just a horn. You wouldn't do that. So why would you do that in an ICU? Why would you not greet people? You know, like, when I go into nothing annoys me more when people are an expert in a tiny little field. I went into a shop. I'm such a good girl. I went into a department store, I guess it was, and I needed to buy stockings to go to the races. And the lady, I'm just standing there overwhelmed. Like, who knew that there were so many varieties? And the woman came up and she said, "Can I help you?" And I said, I need stockings to go to the races. And she said, "Do you need stockings or do you need pantyhose?" And I said, "I need the things that go under your dress that are sort of like see-through." And she's like, "You need pantyhose, that's what you need, sheer. You probably need an arm and you're very fair." And I was like saying, I'm doing a PhD, don't tell me how, you know what I mean? Like, we are all experts in tiny fields. But once you take us out of that, we got nothing. We need to remember that at all times, just to say, the reason that we turn families is this. Every time we do it, we have to assume that that patient on some level is understanding us. You know, like, people say their biggest fear would be public speaking. For me, the biggest fear would be to be naked. I'm not joking. I'm a never nude. I don't walk around. I barely undress to have a shower. To wake up naked in an ICU would appall me. So I would want someone saying, "You're dressed. No one can see your bits, love. You're all right." You know, like, so just small little things like that would make a difference. And, you know, I say to families, what would be really important if they were just sick at home? You know, like, is there, because we deal with children, you know, is there a teddy or a blanket, or sometimes we put photos just on either side of the bed, so whichever way they roll, if they open their eyes, they can see a photo of their family just to reassure them. And people need, you know, just assistance with little basic things. Like, we should never be beyond anything. I make toast regularly, and sometimes I have to sit and help people hold a glass of water to their mouth because they're shaking, because they're frightened. We have parents who fish children out of school, you know, a pool, and arrive with no clothes, just in their togs. And I just think, if that was me, I would be suicidal, first of all. Like, but if that was me, you know, like, what would I want? So I go and find scrubs. Or if I have a jumper in my office, just put it on the person. That's not crossing a professional boundary. It's about giving people dignity, recognising that they are real humans with a story and needs and wants beyond just what is even happening here. Noise level is a really big thing, and I am as guilty of this because I am an idiot all day at work, and I try to make my colleagues laugh to give us all a bit of light relief. But we have to be careful that we're not laughing uproariously when people are at these critical moments. We have to be really careful that there's not music blaring at 10 o'clock at night. You know, it's night duty, you're trying to keep yourself awake, but we're trying to keep people restful and asleep. So it's just about being thoughtful. Because unlike in your neighbourhood, if you're being really noisy at 11 o'clock, people can ring the police. Who can people ring on us? When people get frustrated and call the media or make complaints, it's because we haven't heard somewhere along the lines. All right. God blimey. Real and regular communication. Explaining why you do everything. Reporting what comes from ward rounds if families aren't involved in that. Family meeting, family meeting, family meeting. And if the family meeting's good news, I say, we're going to have a family meeting, don't panic, it's good news. When I ring a family to say, your child's back from the theatre, the first thing I say is, it's Liz from social work, don't panic, there's nothing to worry about, I'm just letting you know. Because they hear, oh my God, social worker, bad, bad, bad. All right. We need to enable families to be present. Families won't know sometimes how to be present and engage with their loved one when they're in the room. So sometimes when people are just standing there, I say, do you normally read? Would you like to read a book? Bring in a book and read. It gives them something to do. Does your dad normally like the newspaper? Why don't you read aloud the newspaper? We need to give them little tips. So sometimes we say, why don't you, your mum's toenails chipped. Why don't you just take it off and paint their toenails? And it makes them feel like they're doing something active. And children can be involved in that. We have children massaging feet and doing sorts of things. Sometimes we have to help family members find enough skin to hold. Lift it up and say, this hand's free. Or just say to the registrar, when you put a line in, if you could keep the hand free just so they've got something to hold. It's just little simple things that enable people to do things. Or just rub moisturisers onto their legs. If the person's quite vain, shave them. Shave their face. Shave their legs. They're just little things that family members can do that help them feel engaged and important and keep people with dignity. I don't think families ask for much. They're not asking that we give them a massage or that we provide 5-course meals. They're just asking us to stay. How do we stay engaged? How do you continue to recognise me as one of the most important people in my family's life? We have to sometimes teach people that because they are so overwhelmed by our environment that's just work. It's our place we see all the time. And you know what? How many days have you been overwhelmed at work? I have. I've been overwhelmed at my own work. So if it can happen to us when you've worked in there for 6 years, what can the experience be for people, particularly in the first days? The other thing I want to say is I totally agree, Renee, that it's not over just because the person's discharged, either because they have died or because they've gone home. People often can't remember what happened, where they were. So my adult colleagues once, after hearing me things that we do with children when they die, said, do you think we could do some of the memory making with adults? And I said, yeah, I do. And they're doing it all the time now at the PA hospital. So if it's a dad or a grandma and there's little kids in and people don't know, they still do hand and footprints. They still do massage. They still take all of the photos. They take all of the lines out and they let people get tucked up into bed. If the person's too big, they lift up their head and just let them sit in their lap. There's lots of memory making we can do. There's lots of being creative. So sometimes I say, we can't save what's happened here, but what would make a difference? And they say, well, look, Dad always loved Slim Dusty. Well, put it on. Play a bit of Slim Dusty. Do you know what I mean? Let them sneak in some camembert and whatever. This is the last days, last moments. Like, why wouldn't we give that to people? We can't always cure. We can't. Sometimes people are so broken by the time they get to us, so injured, so sick, but it shouldn't matter what demographic, what colour, what beliefs people have. There must be some way that we can connect with every single individual. It's more important than the technical skill. Unbelievably, people would rather have a surgeon with good bedside manner than good surgery skills. That's frightening. No, I sometimes say when our neurosurgeons are coming in, don't repeat this, but I sometimes say to families, not so good with this, very good with this. So just brace yourself, because when they're in theatre and near your child's brain, we need lots of this, we don't need this. We'll interpret all when they go. And so when they go, they almost have this jovial thing because we've got a joke going on. So when, you know, so, well, I'm going to cut your brain. And it's like and I'm like, that's right. We warned you, but very good with this. All right, end of the story. The end of the story is never often for families just when they walk out the door. We make offers to every single family to come back, and very few people do. But the ones who do need it, really need it. So whether they come back post-bereavement to say, we still don't understand why our loved one died. And if it's coronial, some of those cases don't come back for 18 months. That's a long time to not understand why your loved person died. So if you make the offer, if you just say, look, you know, I was your nurse, and write it down on a piece of paper, you can give them your work email address. I give out my work email address all the time, and apart from conferences, no one ever gets in touch with me. You know, it's just a little thing to say, you were important. We recognise that this was a significant part of your life and history, even if it was only 30 hours with us. I think I've run out of time. Have a great conference, and thanks again to Renee.